Now it's my pleasure to introduce the second presenter, Dr. Hadel Elhaddad. Dr. Hadel is Internal Medicine Senior Registrar. She did her residency in Dr. Sulaiman Faqih Hospital. She did her fellowship in National Guard Hospital, Jeddah. And she just passed the final written and clinical adult hematology fellowship exam. Her paper title is Transfusion-Dependent Anemia and Cytopenia Secondary to Parvovirus B19 infection as the first manifestation of X-linked hyper-IgM immunodeficiency syndrome in 2 male patients in their third decade of life. Dr. Hadel, floor is yours.
Thank you, Dr. Ahlam, for the introduction. Good evening, everyone. It's my pleasure to be talking today about my topic, which is mentioned by Dr. Ahlam. Next slide, please. We describe TwoMale patients with unique mutation of CD40 ligand gene, unlike a classic presentation of X-linked hyper-IgM immunodeficiency syndrome. Both were healthy until presenting in their early 20s with a challenging symptomatic transfusion-dependent anemia. Investigations confirmed X-linked hyper-IgM syndrome with concurrent chronic parvovirus infection. Hyper-IgM syndrome, next please. Hyper-IgM syndromes are a rare heterogeneous group of primary immunodeficiency disorders characterized by defects of immunoglobulin plus switch recombination with or without defects of somatic hypermutation with impairment of NK and T cell cytotoxicity. This leads to low levels of IgG, IgA, and IgE with normal or elevated levels of IgM and poor antibody function. Hyper-IgM syndromes are genetically determined and are further subdivided into 5 subgroups based on the affected gene. Okay, next. The most common form is X-linked hyper-IgM, which is inherited in an X-linked manner, constitutes around 70% of cases, with an estimated prevalence of 1 per 1 million males. The disease-causing gene is CD40 ligand, located on the long arm of chromosome X. The combined T and B immunological defect is clearly illustrated by the susceptibility of patients to recurrent infections, autoimmune disorders, and malignancies. Half of the males develop symptoms by year 1 of age, and by year 4 of age, more than 90% are symptomatic. Clinical manifestations include infections, liver manifestations, malignancies, and autoimmune disorders, as well as hematological manifestations such as anemia. Next. Clinical manifestations of parvovirus varies depend on the immunological status of the affected host. In children with intact immune system, it's considered a common self-limited and usually causes a mild febrile illness, while in adults it may cause arthritis. On the other hand, when immunocompromised patients get exposed, their immune system is unable to produce neutralizing antibodies, and viremia persists and might cause aplastic anemia and RBC aplasia. Next. Rarely, certain CD40 ligand mutations can result in mild phenotypes of X-linked hyper-IgM. These patients remain asymptomatic and undiagnosed, with the disease manifesting only after exposure to parvovirus B19 infection, just like our patients. Case 1 is a 20-year-old male who had completely normal childhood with no recurrent infections, presented with intermittent transfusion-dependent anemia of unknown cause, despite extensive investigations over 6 years. He had cyclic episodes of fever of unknown origin, weight loss, and night sweating, accompanied by drop in hemoglobin with hepatosplenomegaly. Despite relatively prolonged periods of spontaneous remissions for almost 3 years, the patient relapsed and became progressively transfusion dependent, needing transfusion almost every 2 to 3 weeks with thrombocytopenia and neutropenia. His initial bone marrow biopsy only showed evidence of an effective erythropoiesis. A repeat bone marrow biopsy showed erythroid hyperplasia with maturation arrest and features consistent with parvovirus B19 infection, as illustrated in this figure. The first figure and the second one are bone marrow aspirate showing the viral inclusions, and here the bone marrow biopsy showing also the viral inclusion. In view of the bone marrow biopsy findings, parvovirus PCR was sent and it detected parvovirus genetic material. because it's very unlikely for parvovirus B19 to cause such a picture in immunocompetent patient. The infection with parvovirus raised the possibility of an immunodeficiency syndrome and led us to perform whole exome sequencing, the result of which revealed the presence of mutation in the CD. Immunoglobulin levels were checked, and he had mildly elevated IgM, slightly low IgG, and normal IgA. He was born of a consanguineous marriage. His mother was negative for the same mutation with negative family history. With negative maternal family history of similar condition, making his diagnosis as de novo X-linked hyper-IgM. The patient was treated with IVIG course for 3 days, followed by monthly infusions, and shortly after the infusions, he had a tremendous response in his CBC and complete normalization of symptoms. This table showing his hemoglobin of 5 before treatment improved to 16 after treatment. And this is the result of the parvovirus B19 serology and PCR. And here the result of the whole exome sequencing showing the mutation of CD40 ligand, its variant and its type and the classification. Next. Case 2 is a 22-year-old male who had also completely normal childhood with history of recurrent mild sinusitis and ear infections, presented with symptomatic anemia. His hemoglobin has fallen to the low levels of 4.8 and neutropenia. He had hepatosplenomegaly. Investigations ruled out hemolysis. He had severe reticulocytopenia and viral serology was positive for parvovirus B19 IgM. Bone marrow examination showed similar features to case 1, and based on our previous experience with the first patient, which raised the suspicion of immunodeficiency syndromes, whole exome sequencing was sent.
Dr. Hadel, you are muted now.
Sorry. Okay. Case 2 is a 22-year-old male who also had completely normal childhood with history of recurrent mild sinusitis and ear infections, presented with symptomatic anemia. His hemoglobin has fallen to low levels of 4.8 and neutropenia with hepatosplenomegaly. Investigations showed parvovirus B19 IgM. Bone marrow examination showed similar features to case 1, and based on our previous experience with the first patient, which raised the suspicion of immunodeficiency syndrome, whole exome sequencing was sent and showed CD40 ligand gene mutation. Immunoglobulin levels showed mild elevation of IgM with low IgG and very low IgA. The patient required 4 months of transfusion, and it took him around 30 days to become transfusion independent and another 60 days before normalization of his hemoglobin. Patient was born of a consanguineous marriage, and family members testing is currently being conducted. This table showing his investigations and hemoglobin of 4.8 at baseline improved to 13.3 after transfusion. And here is the result of parvovirus and the whole exome sequencing showing the mutation of CD40 ligand with its type and classification. In the early years of life, usually with different presentations, mainly infectious. Here we are reporting 2 unique patients with a rare presentation in regards to the age of presentation and to the presentation itself, as both presented with chronic anemia induced by parvovirus B19 infection manifested after the age of 20 years. There hasn't been in the literature a clear association between specific mutations and the clinical phenotype of the patients. In a retrospective analysis of 98 patients with X-linked hyper-IgM syndrome, only 6 had mild clinical phenotype. 3 out of the 6 patients presented with parvovirus B19-induced anemia. These 3 patients were completely asymptomatic until they developed chronic anemia caused by parvovirus infection at the ages of 8, 14, and 17 respectively, and all the 3 patients responded well to IVIG. One of the 3 mild phenotype presenting with parvovirus infection-induced anemia had the same mutation expressed by case 2, which is a missense mutation, while case 1 had a stop-gain mutation, which is a very rare variant that has not been published yet in any of the genetic databases, and classified as likely pathogenic based on the American College of Medical Genetics recommendations. This table showing all the published cases with X-linked hyper-IgM and parvovirus B19-induced anemia in adolescent and young adults, and they were all published in one paper by Siyama. In conclusion, In conclusion, we are reporting 2 cases of late presentation of X-linked hyper-IgM. The similarity between the 2 cases is the occurrence of protracted anemia requiring blood transfusion from an unexpected relatively benign virus. The other point of similarity is their relatively late presentation, probably indicating a milder form of disease from these 2 reported mutations. The occurrence of such a clinical scenario ought to raise a high index of suspicion of an underlying immunological disorder. We believe in the era of easily accessible molecular diagnostics, and more undiagnosed cases will come to light with heightened awareness of this condition. Thank you.